A very good afternoon to you, dearest listener. How are you doing today? Hope you're having a lovely day. Glad to have you join us on today's episode of the program Your Health on BCA Radio 88.1 FM. Omahia. My name is Nkechi Uduma, and today we shall be discussing about the ongoing measles rubella vaccination campaign. And to talk in detail about this particular topic is a public health physician and public health analyst, Dr. Obasi Chikezie. Good afternoon, doctor, and welcome.
Good day, my dear, and good day, listeners.
All right, I am not alone today. I've got my co-presenter, Chinezerem Abakuru. Good afternoon, Chine. So glad to have you on today's episode.
Thank you, NK. I'm so glad to be here.
All right, without further ado, let's go straight to the first question. Doctor?
Okay.
Please, can you define measles and rubella?
First, measles, most of our people understand clearly what measles is the typical type of disease that manifests with high-grade fever. We could see the kids with coming down with rashes, all over the body. The rash is itchy, and many a time, the mothers will apply, I'm just using what layman would understand clearly.
Okay.
Mothers will apply calamine lotion. It is a very highly infectious disease, and we are seeing it a lot among children, especially those above 9 months. It's when you see a child with multiple rashes, all over the body with fever, and then itchy rash, the mother should take the child to the hospital. We normally say the child is above 9 months. We normally say this is typical of rash until proved otherwise. For the emphasis of the public, I think I need to stop there before I begin to differentiate multiple other diseases who have rash. But
Yes.
This is what the public consumption should be, because that should be first important for the safety of the child and daily treatment.
Okay, so what are the symptoms of measles and rubella?
We can differentiate this using a very few distinction. We see that rubella, which is German measles, okay, let me put it this way. Rubella is known as German measles. Then rubella is called the typical measles we know. The difference is just in the pronunciation, rubella and rubella. Now, most of the German measles, let me use the German measles and the normal measles we know. It usually has minimal low-grade fever, unlike the normal measles we know, which is high grade, which I defined earlier. And you discover that it may not come with any symptom, unlike measles that will come with cough. The eyes will be reddish, what we call conjunctivitis and coryza. But in German measles, you may not see it. That's what we call Copley spot. That's where you open the child's mouth. Now, in German measles, that's completely absent, but in rubella, it is there. And then you discover that the rash for rubella would always, as German measles, would always be within 3 days. Unlike that of the measles we know, it's about 6 to 7 days. And then there's what we call lymphadenopathy. Now, lymphadenopathy is when you put hands maybe in the groin or in the armpit. You notice that there is a lump when you have, the fever infection. In that of measles, what we normally see is it's all over the body. But on terms of that of German measles, you see that it is just behind the ear, which we call auricular German measles. So that common symptoms people could actually understand. But like I said again, in the presentation, the German measles actually may or may not present with anything, but you see, it normally affects children which are, with what we call congenital rubella syndrome, CRS, whereby the child could have birth symptoms like, deafness of the ear. You could have heart deformation. You could have hearing impairment, just like we call deafness of the ear. Hearing impairment. You could have problem with the eyes. You could have problem with the heart, or even the brain. So we see that. But for that of measles, the one we know clearly, it doesn't really occur with those autonomic symptoms. And for a long period of time, we see that the German measles hadn't been very much of concern to many of us. It affects mostly children that are unborn, worse when it affects the baby within the first trimester. The birth defects are much. That is what we call congenital rubella syndrome. And so the birth defects are worse when they occur within the first 3 months of pregnancy than when they occur later on in the pregnancy. Generally, both of them are viral infections. The in this present campaign, previously what children were being given was just the measles vaccine. So Nigeria actually is rolling out a vaccine that now contains that for rubella, which is the German measles.
Okay.
And this is the first time it's being rolled out in Nigeria. And that's why the campaign is massive. And I got to understand in Abia State, we are looking at having just a little bit less than 2 million children covered, aged between the 9 months and 14 years.
Wow. All right, doctor. How dangerous are these diseases?
Like I said, if they go unmanaged, especially for the ones that affect children, which generally we may not have much to do, when the child comes with congenital, in Igbo land, as in it occurred in the womb and the child came out with it, it becomes difficult for us to hear. If you have a disease that actually causes a child to be blind, have cataracts or have eye problem, it's a difficult thing to manage. Or had some heart problems, it's a little bit difficult thing to manage. Now, for the measles, many of us are fully aware. Yes, those ones are managed what we call symptomatically. We manage them by reducing the age, bearing in mind that the rashes will disappear after some days, actually. Within 6 to 10 days, the rashes will disappear. So we now know clearly that those kids will be kept and isolated in a place where they would not infect other children. And the itchings are managed, the eye discharge is managed. Some of them that will come with what we call pneumonia, other diseases, they are equally managed. And then they are given vitamin A and other food supplements to make sure that they don't go down with malnutrition. Because then there is what we call eating hunger, which affects these kids more because the viral infection will deplete of them, those micro elements that are in small amount of quantity. The body requires just small amount. So if we don't take time, it depletes them. Then, but what we usually do, like I said earlier, is first you isolate the kids, begin to manage the itches, and you see our mothers applying calamine lotion, antipyretic lotion, and if they have wounds anywhere and they are equally managed, then other diseases that follow it, like pneumonia, that are managed as such.
Interesting. Doc, this campaign ought to last from the 4th to the 13th of this month, February, a whopping 10 days. Why is it this massive?
This campaign is of 2 phases. The first phase occurred in the northern part of Nigeria, including Oyo State. That lasted till the end of last year. The second phase had come up now, and the target is to cover about 106 million children across the Federation. Children aged between 9 months and 14 years. Now, this second phase, which is targeting the southern part of Nigeria, except minus Oyo State, is targeting about 43 million children. And I know clearly in Abia State, like I said earlier, they're targeting 1.9 something million children. So you could see that the job is huge. The population to cover is huge. This is to abridge like having 14 years old gap on rubella. That German measles. That's why you see it's handling between 9 months and 14 years. That means those that are 14 today who didn't get the vaccine when they were supposed to get it at 9 months are now to take it. And it's handled it from there 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 years. So you can see that the deficit, the block that this campaign is targeting is huge. And that block actually accounts for this number of days and enormous responsibilities thrown and attached to it.
Okay. All right, Doc. I think you've already said a bit about this next question that I'm going to ask you. And that says, if some children miss the vaccination, are there plans to actually capture them?
Yes, listen, although we don't expect any child to mix the vaccination,
okay,
our health workers are fully trained to go to areas in Abia State. I know there are some security challenge areas which the state government tried as much as they could to handle. However, the vaccine is now being incorporated into our routine vaccine exercises. The routine vaccination we give children in various states and various health posts. So it is now going to be MR, that's measles rubella campaign vaccine. So you could see that any child that misses it now has the opportunity of getting it back again. Though we do not expect. I hope that after a while, there are more pop exercises that usually follow these type of campaigns. Because we know some children may be sick, some children may not be available now. So I'm pretty sure the State Primary Healthcare Development Agency, in conjunction with National Primary Healthcare Development Agency and UNICEF, was going to make sure that these kids are captured in future. But we expect that every child that is healthy, that can receive vaccine, unless stated otherwise by the assistance of by the confirmation of a medical doctor or health worker, should be able to be covered in this exercise.
Okay, so how safe are these vaccines? Because there are some myths around these vaccinations. Some parents feel that it will affect their children's reproductive system and such myths. But I need to know, or we need to know from you, how safe are these vaccines?
Okay, first of all, I must commend our women. I take my time to commend them. I must commend our women, our mothers. They've shown resilience when it comes to vaccination. They've shown good faith. They've shown, motherhood. They've shown all it takes, to be wonderful mothers. So our women have shown gratitude to the government, gratitude to UNICEF by presenting their kids right from, the days you were even born. I'm pretty sure that. And for many of us who have seen mothers who are married, who have children, we know that our mothers vaccinated them, even if anything in this part of Nigeria. So I think clearly the vaccine has shown a whole lot of faith and trusted in it. Our people over the years have seen that these myths are not the correct myths. I can tell you for free. Many of the myths are started when we were talking about polio vaccination. That was late 90s and early 2000s. And then so many of those, mass campaign, because polio vaccination, those that were born in 70s like myself, we've been receiving the polio vaccine. So that's not we received it, while as children. And then when the mass campaign to eradicate polio came, most of these myths came about. But we have seen that these children grew up, and many of them are mothers today. We have seen some Gen Z mothers who received these vaccines. What I mean Gen Z, those born after 2000, they are today, having the vaccines. They've not shown any faith, any sign of infertility. And by the way, ever since this infertility issue had been there, we noticed that Africans have continuously increased in population. Nigeria has continued to increase in population. So that myth is not correct. Now, contrary to that myth, what have you noticed? We've noticed that most mothers, when they have their children, these children survive. We've noticed that most mothers today would rather tell you that they want to have 3 children, unlike what we used to have previously, where mothers would have 8 only to have 2 or 3 survive. But today we have 3 children, and the 3 children will survive thanks to the robust vaccination that has helped us keep preventable diseases away and help us defeat child-killer diseases. Now, we must lay emphasis that vaccine is a potent mechanism. It's what we call cost-effective mechanism of trying to prevent diseases. And cost-effective here in the sense that it's almost at no cost. For us, if you really consider the cost of managing these diseases and put it side by side with the cost of receiving vaccine, you find that the parents, we don't pay anything. Let me make emphasis. Minus the amount of time you spend taking the child to the hospital and probably the transport cost, so that there's nothing else you are losing. But you have actually given the child a ticket to life. You've actually given the child a ticket to quality life, not just life. Because if you take a look at the southern part of Nigeria today, hardly would you see anybody less than 20 years that has polio. That is the power of vaccination.
That's true.
And all those that have gotten this polio vaccine, all those that have gotten DPT, all those that have gotten yellow fever, and so many other vaccinations, they've actually been procreating. So that myth is not right. We'll be trying to debunk it, and we keep on telling our people it will resurface. We know it will resurface. So in this era of social media, where unverified content are posted, we know it's going to resurface. But it's our duty. It's the duty of your radio station, BCA Omaya, to make sure that our people get to understand the truth. And the truth is that this vaccine don't cause impotence. These vaccines are potent. These vaccines will give life to our children.
All right, Doc. This next question is actually personal. So I have a 7-month-old baby, and in the next 2 months, we shall be going for the measles rubella vaccination. So what I just want to know is, are there signs for me to expect after the vaccination? What should I do in such situation?
Okay. If you will go for that vaccine, of course, I'm pretty sure the 7-month-old child are taking vaccine.
Oh,
And
she's updated.
Beautiful. And I'm pretty sure the child may experience some fever, mild discomfort when the vaccine was given, which most of the time, once you give paracetamol or even allow the child sleep overnight, the child gets well. That shows the body has actually accepted the vaccination. It shows the body is reacting to developing, antibodies. It shows the vaccine is potent enough. So we don't expect more than that, in this polio vaccination. I mean, this MR vaccination we're going to give the child. Maybe some children may react to that, but we don't expect more than that. But peradventure, there's what we call AAVI. That is adverse event, form, which when you're following immunization, if you get it, which is a very rare occasion, if there's anything that you think happens to the child which is unusual, after getting vaccine, please don't hesitate to get back to our health, facilities, and then or to the center where the vaccine was given, and we'll take it off from there. But I can assure you, the majority of time, just like you that have given the child other vaccines, you see that the child, it almost went without adverse events. And I believe that this is how majority of these vaccines behave in other children. And even in your own child, that when he or she receives MR vaccines. But I must tell you, that these vaccines don't go by just anyhow. They are not just manufactured for manufacturing sake. They are tested over the years. And remember, these vaccines have been given to children in much more developed world. So it's not like the world is introducing a new vaccine. It's not that we are incorporating it into our routine vaccination. So we're expecting that the child will come out without having much adverse effects.
All right, Doc.
Thank you so much, Doc. Before we let you go, we'd like you to give your parting word to our listener.
Yes, first of all, I must thank the First Lady of Abia State. I learned that she was there to commission the flag of the campaign. I only learned that it was integrated with e-health, e-recording mechanism of Abia State. I only learned that some places they give women add-ons. Well, they give them incentive to bring out their children. So I must give them thumbs up. I must thank them. That's an appreciation. And it shows that she's indeed, a mother at heart. So our listeners, one thing you must give it in a child, one thing certificate you must give with any child is a very simple certificate. A certificate to a better life. A certificate to treat diseases. A certificate to avoid preventable diseases. Please, that certificate is very simple. The one we can give from our health sector is, preventing child killer diseases. And we expect that, please, mothers, we expect parents, we expect every adult to make sure that every child who is less than 14 years is encouraged, is taken to a nearby facility, is made presented before our health workers to receive this MR vaccine and any other vaccine that is necessary. We expect us to ask every mother who is an adult, the males listening to us, have you been giving the child this MR vaccine? That is what we should be able to ask every child and every mother. And we encourage our teachers while they're in school to present our children before the healthcare workers. We ask our priests in the church to please encourage our congregants to present their children. And to all of us, what I will say with just a parting word in Igbo, and I believe that majority of people are Igbo listeners.
All right, Doc. Thank you so much for coming on the show this afternoon. We really appreciate your time. We really, really appreciate your time. Thank you so much.
Thank you very much.
All right, that was Dr. Obasi Chikeze, a public health physician and public affairs analyst, Esut Teaching Hospital, Park Lane, Enugu. This is where we round off on today's edition of the program, Your Health. The station is still BCA Radio 88.1 FM, Omahia. Not forgetting my co-presenter, Chinezerem Abakru. Thank you so much, Chinez, for coming on the show this afternoon.
Anytime.
All right, dear listener, do have a lovely afternoon and bye for now.